Temporal arteritis, or giant cell arteritis, GCA, is typically a disease of older adults, particularly those over 50 years of age. However, temporal arteritis with thrombosis in a young adult is extremely rare and atypical. When this condition occurs in younger individuals, it warrants a thorough differential diagnosis to rule out other causes of vasculitis or systemic inflammatory conditions. Key considerations for such a case might include 1. Takayasu arteritis. This large vessel vasculitis primarily affects younger individuals, particularly women under 40. It can involve the aorta and its branches, including the temporal arteries, mimicking GCA. 2. Vasculitis in systemic conditions. In younger patients, vasculitis can occur as part of a systemic disease, such as systemic lupus erythematosus, SLE, Behçet's disease, or antiphospholipid syndrome, APS. Thrombosis is also more common in these conditions. 3. Thrombophilic conditions, an underlying hypercoagulable state, such as inherited thrombophilias, antiphospholipid syndrome, or even infections, should be considered if there is evidence of arterial thrombosis. 4. Infectious arteritis. Infections like syphilis, tuberculosis, or HIV can cause arteritis, particularly in younger individuals, and may lead to thrombosis. 5. Trauma or drug-related causes. Cocaine or other vasoconstrictive drugs may trigger vasculitis or thrombosis in young patients. A diagnosis would typically involve temporal artery biopsy. This remains the gold standard for diagnosing temporal arteritis. It can help differentiate between GCA and other causes of vasculitis. Imaging. Ultrasound, MRI, or CT angiography can assess the extent of vascular involvement and detect thrombosis. Blood tests, inflammatory markers, ESR, CRP, as well as tests for thrombophilic conditions and autoimmune diseases should be performed. Treatment usually involves corticosteroids, often in combination with immunosuppressive drugs in more severe cases. If thrombosis is present, anticoagulation might also be needed, depending on the underlying cause. Early diagnosis and treatment are crucial to prevent complications such as vision loss or stroke.